आपका रिकॉर्डिंग?
यस सर, अभी रिकॉर्डिंग हो रहा है।
जॉर्ज सर के इधर हो रहा है।
ओके
Because he asked for the permission, so okay.
जॉर्ज सर, अच्छे से वो रिकॉर्डिंग करो, वो ट्रांसफर हो जाएगा, फिर आराम वालों को आपको भेजना पड़ेगा वो। ठीक है?
Okay.
ओके
एक लिंक फॉर्म में आ जाएगा, वो लिंक आएगा, वो भेज दीजिएगा।
बाद में। हाँ
हाँ, आपको कहाँ पर रिकॉर्ड होगा वो भी जरा देख लीजिए। दैट विल बी चैलेंज टू फाइंड आउट वेयर इट इज गॉट रिकॉर्डेड। अब
वो
फिर
माय कंप्यूटर्स रहता है ना, उसमें डाउनलोड
हाँ,
रहता है, उसमें जाएगा वो
जूम में रहेगा, जूम में
हाँ,
रहेगा।
जूम
में
वो
रहे-
जूम में रहता है, वो जरा
Zoom
देख
में
लीजिए।
करके
नहीं,
हेडिंग आएगा, उसके अंदर आपको फाइल में मिल जाएगा।
नहीं
ओके?
तो मुझे बोल दीजिए, मैं आपको हेल्प करूंगा।
यस सर, विष्णु सर है तो आप टेंशन मत लीजिए, सब कुछ हो जाएगा। कुछ भी आपको प्रॉब्लम आएगा तो आप पूछ लीजिए, सर है।
अनिल
ओके
Yugandhara ji also was there in, I remember her name, but I'm not remember which, you did some camp also? Yeah, you were part of the participants, I think.
नो सर, आई डिडंट डू एनी कैंप। हाँ, अभी मेरा हो गया, माइग्रेन का हो गया था कैंप।
Ah, okay. No, I
लास्ट
had seen you attending the Women's Day, probably you were
हाँ,
there.
आई वाज देयर लास्ट
Hmm.
ईयर।
Hmm.
या स्टार्ट नाउ और
यस सर, टाइम हो गया है आपका 9
Yeah,
o'clock।
9-1
yeah. Start with the prayer, sir.
विष्णु
Sir,
सर वी स्टार्ट।
please. Yeah, sir, please start.
गुड मॉर्निंग एवरीबॉडी, नमस्ते सर, यू स्टार्ट।
Good morning, sir.
Good morning to all of you.
Good morning, sir.
When it comes to yoga, we start all the yogic activities with the prayer. So I will request George sir to start with the prayer, and then we'll go ahead with the proceedings of this.
I want you to
workshop
display the prayer for everybody so they know. I can't see the. Yeah. Okay. Everybody, I want everybody to sit straight with your back straight. Close your eyes and get to calmness. Take a deep inhaling, deeper, longer exhaling. Relax your body. And I want you to, if you know the prayer, it's fine. If you don't know the prayer, we'll say the prayer together. Om Sahana Vavatu Sahana Bhunaktu Sahaviryam Karvavahe Tejasvinaditamastu Ma Vidvishavahe. Om Shanti Shanti Shanti. I will share the meaning of the prayer. May God, Om, may God protect us both. May God nourish us both. May we work together with energy and vigor. May our study be enlightening and not give rise to hostility. Om, peace, peace, peace. Now rub your palms, make it warm enough. Place your warm palms on your closed eyes, cup your eyes. Relax. Vishnu, over to you.
Good morning to all of you. On behalf of Sushma Maurya Madam and Ambika, on behalf of Arambha Yoga Institute, this is Vishnu Raut welcoming you to the workshop on diabetes management. Before we start this workshop, I would like to say a few words about Arambha Yoga Institute. Arambha Yoga Institute is accredited by Yoga Certification Board, Ministry of Ayush, Government of India. It is an ISO certified institute for the international standard that specifies requirements for a quality management system that is called as QMS. It is running as an educational wing of Arambha Yoga Foundation, a public charitable trust registered under the Bombay Charitable Trust Act. We work to enlighten the world, especially young aspirants, with quality education, training, and guidance in yoga teaching profession. Further, introduce them to the real essence of yoga and its benefits. By applying yogic practices to their lifestyle, they get benefited with the improved life balance, hence creating a better individual, better society, and leading to a better nation. To conduct this workshop, we have a very committed yoga teacher, Mr. George Joseph. I would like to give his brief introduction. George Joseph, passionate yoga practitioners for over 25 years, and hence living a medicine-free, disease-free life over 22 years. He has completed Yoga Volunteer course YV, Yoga Wellness Instructor YWI, certification by the Yoga Certification Board and the Ministry of Ayush. Now he is preparing for the Yoga Teacher and Evaluator and Yoga Master program. He is holding Diploma in Naturopathy and Yogic Health Sciences and a certified mind hacker coach, laughter yoga expert. He has helped and trained more than 250 students to be free from lifestyle diseases like diabetes, cholesterol, hypertension, asthma, PCOD, back pain, arthritis, thyroid, etc. Laughter yoga expert also part of his giving to a cancer and thalassemia patient in Dubai and supporting Dubai Health Authority by donating over 80 times blood platelets and have received appreciation from all the corners. Authored a book titled Regenerate Yourself with Yoga and Naturopathy in the year 2021. He is very humble in saying that he is looking forward to being of service to the mankind. Over to George, sir. You may proceed with your.
Can you share the screen? Thank you, sir, for your introduction. I wanted you to move to the next screen, sir. Yeah, my introduction has already been done, so everybody knows my introduction. Yeah. Okay, now we're going to have these sessions from Monday to Friday, and our camp lesson outline is as follows. Today, we'll be only discussing on the disease, the types and management of diabetes, and then we'll have an interactive question answer session. From day 2 onwards, I want everybody to be on their mats. We'll have a yoga session. We'll have a discussion. If you have any doubts, if you have any questions, we'll have the yoga classes. And at the end of it, we'll have a conversation, interaction. And every class, there will be a feedback form, which I request you to fill. I'll give you 1 minute time, 1 or 2 minutes time to fill it up and submit it as part of the feedback, because feedback is very important for me and for the institute as well. So where I can improve and where the institute can improve for everybody. Thank you. And let's move to the next. Okay. Now, I want to know if I wanted this to be an interactive session. Now, I know people have all put their videos off. So if you can put your videos on, and if anybody is particularly having any issues with diabetes, I want you to come up and be open with it. Now, first of all, I know everybody knows what is diabetes, but let me highlight it. It is a chronic disease. Now, when you say a chronic disease, is actually something which is persisting, remaining there in you, and something which you can overcome. But there are different types of diabetes. We'll go into that later. So diabetes is it starts from the pancreas. Your pancreas is the one which produces the hormone insulin, which actually regulates the energy level in your body. So basically, if your pancreas don't function properly, then you have all these issues. So basically, you must understand that to keep your pancreas healthy, you need to, for now, there are different types of diabetes. I've already told you what is diabetes. It is basically a disease which your body does not produce insulin, or your body cannot effectively use the insulin it produces. Now let's move on to the other slide. Okay, of course, insulin is a hormone that regulates the body energy. Now, yeah. Now, what are the symptoms of diabetes? You have frequent urination, extreme thirst, excessive hunger, frequent weight loss, tiredness, that you feel lethargic, lack of interest and concentration, numbness in the hands or feet, and blurred vision. Now, in yoga, in the medical team, there are 3 P's. Anybody knows what are the 3 P's in diabetes? Anybody? You know what's the 3 P's? The 3 P's is when you have these symptoms, you normally tend to be diabetic. One is polyuria, where it is, I've highlighted that frequent urination. Then polydipsia is actually excessive thirst, and polyphagia is excessive hunger. So all these symptoms, believe me, these symptoms are normally in any diabetes patient. So basically, let me tell you a story. I was once about maybe 20 years back, 25 years back, I had gone for a blood checkup, and my blood showed 300, the diabetes level, the blood sugar level. Now you can imagine what does it signify? It signifies that you're a diabetic. The doctor told me you are a diabetic. But first of all, you have to have a strong willpower. Your willpower says, I'm not having it. The doctor asked me few questions. Means not this doctor. See, basically the doctor is interested in you having medicines. He is not interested. He wants you to get hooked onto the medicine lifelong. So his intention is very clear. I want to give this gentleman a medicine and let him be hooked for lifelong. Whereas you must understand that if you have a strong willpower and you can go and take another opinion of another doctor, and kind enough, I was blessed to get another doctor who is very, very clear in his focus on treating me. He said, see, I don't want to give you medicine. Do you have frequent urination? I said, no. Do you have frequent thirst? No. Do you have excessive hunger? Very rarely. Okay. Can you do me a favor? Can you make changes in your lifestyle? And we will do a test again. But as per your report, it shows you're highly diabetic and you need to be on medicine. Now, religiously, my doctor, because of his clear instruction, he told me you have to do a couple of things. First of all, every day in the morning, you get up. First of all, you get proper sleep. Get your proper sleep, get up in the morning, drink a lot of water, clear your system, go for a walk. Go for a 1 hour walk and sweat it out. And when you're walking, take deep breathing. After you come back from your walk, then you can do some exercise and then follow the diet. Diet is the most important thing in diabetes. First of all, you have to drink a lot of water, avoid sugar, salt, all these things, all the fried stuff. Try to eat as far as possible raw stuff. You can have nuts, you can have fruits, you can have vegetables. Try to avoid oily stuff. And he said that you keep yourself calm. Say your prayers daily. Keep your mind at peace and make sure that you're getting enough sleep. If you do all this, I will see you in another 25 days. You come to me. Believe me, if you do this religiously, every one of you, I did it religiously, came back. He did another test and he told me, George, you do not have any diabetes. You can enjoy your life, do whatever you want, provided you stick on to what I told you, do this daily. And I have been doing yoga for the past 25 years now. I have never seen a doctor. I have undergone all the medical tests and not having any issues, no diabetes, no blood pressure, no cholesterol, no BP, no back pain, no issues, absolutely. So basically, I want everybody to religiously, it's my personal experience. You follow the diet and you follow your practice, you will be okay. Okay, now let's go on to the next slide, sir. Okay. Now, why? What causes diabetes is, as I mentioned to you, physical inactivity. This is the main cause of diabetes. Physical, and then you tend to be obese because you're continuously eating. And then it's not getting digested, it's just accumulating as fat, and obesity is a big issue. Next thing is the viruses and the toxins. That means basically you taking they say for every ill, there's a pill, right? For every ill, there's a pill. But you must understand one thing, our body is such a powerful body that it can overcome all diseases, provided you give it time and you give it, what do you call that? The energy to overcome the disease. We often forget, we always run to the doctor and the doctor cures us. There are various instances where I can tell you, like, for example, if you've eaten something, not agreeing to your body, what happens to you? You normally start vomiting or you have a loose motion. So most of us, what we do is we get so worried, we don't probably, keep ourselves hydrated, but we go to the doctor and we search for a pill. The doctor gives you a pill, stops your vomiting, stops your diarrhea, and you feel you're okay. I'm sorry, you're not okay. The poison is still in your body. You have to vomit it. You have to vomit everything out, continuously keep yourself hydrated, maybe having, lime water, glucose, whatever, but see that your body is not dehydrated. Let the vomiting happen. Let the poison get out of your system. If you're having loose motions, let the loose motions be effective. You have to let it be drained out from your system so that the toxicity in your body gets out. All diseases is because of toxicity in your body. Why do people go for detoxing? Because people want to remove the poison in your body. The moment you have poison in your body, you have all the illness. So please take care that you need to clear your system. Cleaning your system is the most important thing. Then, of course, I told you, please, people are overweight and insulin resistant. Then they have abnormal increase in glucose production by the liver. So basically, as I said, follow a couple of things and note where. See, you must listen to your body. Your body gives you signals. If you don't listen to your body, I'm very sorry to tell you that we know everything what is happening in our computer, but we know what is happening in our cars. We immediately go for servicing. And now tell me one thing: if you're driving a petrol engine car, will you put diesel in the car and drive? Will you do that? Why? Well, it'll spoil the car, right? So same thing with our body. If you put the right things in your body, you will benefit. If you put the wrong things, your body will get diseased. This is how diseases. Okay, so next. Okay, now we'll go to see what are the types of diabetes. Now you must see here, I've given you the picture. What is a healthy pancreas? The healthy pancreas produces insulin, and then the insulin is going to the cells, and then the glucose is given out, and then it's going to the body for you to get energy, and you get all your activity going on. Now, when you have type 1 diabetes, your body does not produce insulin at all. Fails to produce insulin. So then you have all the issues. And type 2 is where it produces insulin, but your cells do not respond. Cells fail to respond in circulating the insulin. So you must understand what are the types of diabetes. Type 1 diabetes is something which, it's not curable as such so easily. It's not curable because sometimes it is a juvenile diabetes. We get it at a young age, or it is something in the genetics wherein your pancreas don't function. I have a cousin of mine when he was 20 years old, he's having, his kidneys are packed, and he's having 3 times a day injections. Today, he is 68. Why? Because he is very particular on having his insulin, because you need insulin, your body needs insulin, and he's taking care of his diet. And that's the reason he started his diabetes at the age of 20. And when I say type 1 diabetes, your kidney, your pancreas don't function at all. It's dead. So basically, he has been surviving, and very active person, goes for golfing, goes for playing, and keeping himself. So this is what I'm trying to tell you is that even if you have type 1 diabetes, if you take care of yourself, nothing is impossible. You will live your life. Normally, today he's driving a car, he's enjoying himself, provided he follows the protocol, which is like taking the insulin on time. Because if you don't take your insulin, you collapse. You can become unconscious. It's very dangerous. So you're very, very strictly, because that is type 1 diabetes is the most, I think it's not curable actually. Then we have type 2 diabetes. Type 2 diabetes which is the sugar diabetes, where your blood sugar levels go high. And the third level is your gestational diabetes. This is for ladies when you get pregnant, when you're carrying your thing. you often get blood sugar level going high, and where the doctors treat you with either injection or with medicine. So yeah, my wife also had the same issue with both the deliveries. So basically, this is something which you can, but after your delivery, your the diabetes goes away. So the next slide. Okay, now I'm again trying to show you what is type 1 diabetes. It's once known as juvenile diabetes, insulin dependent diabetes. It is a very chronic condition. As I said, the pancreas is shut. No insulin, a little insulin. What are the symptoms? Feeling thirsty, urinating a lot, bedwetting in children, and during the night, feeling very hungry, losing weight without, trying. That means you're a couch potato. Feeling irritable or having other mood changes, feeling tired and weak, having blurry vision. As I said, the causes are through genetics, exposure to viruses, and other environmental factors. Now we go to type 2 diabetes. The type 2 diabetes is a lifelong disease where your body, from using insulin the way it should, it's not using it. So people who are like middle-aged or get older, they have this onset of diabetes. So what are the symptoms? As I told you, you don't notice them. Now, so many people, they are very lethargic. They're very cool. They're very cool about it. Being lethargic or being, sleepy always or very lazy. And then all the other symptoms like blurry vision, tingling in the hands. As I keep on telling you, listen to your body. Your body gives you every signal. And if you listen to your body's signal, I also repeat, we take care of our cars. We know when the signal cars don't function, when suddenly it's giving a noise or it starts jumping or it starts, going against what you want to do, means what you feel is not giving you a comfortable drive, you take the immediate action. So same thing, our body also. Please focus on your body. It's very, very, very important. Okay, now, what are the causes? Some bits of the DNA affect your body making insulin. You're overweight, metabolic, too much glucose from your liver. So now we go to the third one, that is a gestational diabetes. I've already told you. It is diagnosed during the time of pregnancy only. High blood sugar will affect your baby's health. So basically, you need to control it, or else the baby will get into complications. Okay, so then what are the causes? Excessive weight. That means some people are obese before pregnancy. And of course, your hormonal level changes. So basically, you need to keep yourself in check. The doctor tells you, and he does your test, and he gives you the necessary insulin to keep your blood sugar norm. Let's go to the next one. Now, if you do not listen to your body and carry on your life as it is, you have a lot of other complications. If you continue having your diabetes medicines, you tend to get blood pressure, you tend to poison your kidney, your liver will get damaged, your heart will have a problem. And you can even see it in your teeth. You'll have bleeding of the gums, you'll have a lot of issues with so basically what happens when you do not take care of yourself, you get heart disease. People with diabetes have a high risk of heart attack and stroke. Eye complications, like all this high level of this thing, they have glaucoma, they've got all this blindness, all these issues happen. So basically you need to, keep yourself healthy by doing basic things, which we will of course drive into during the course of the program. But I want to tell you that you have to keep your mind strong. We normally are being trained by our parents to go to the doctor, and the doctor is the God. Whatever he says is good for you. No, I'm sorry. The doctor is not God. It's you have to take care of your own body. And that's how you overcome all the issues in life, basically. So now kidney disease lead to kidney failure. So many people have lost their lives because of kidney failure. going for dialysis after that. So nerve damage, okay, foot problems. They start getting varicose vein as well. So please, be aware of what's happening. And these are the very highly risky complications. Skin problems, dental disease, the bleeding of the gums. And, so better keep yourself teeth clean, brush your teeth day, morning and evening. Always wash your mouth, rinse your mouth, and try to avoid all the, stuff which gets stuck into your teeth and, you remain there. But cleaning is the most important thing. So make sure you clean your teeth. Okay, next, sir. Okay, now, as I told you my story. I have made the life changes. What are the life changes I made? I've told you. Correct yourself, always. Now, quality of your eating. A person, if you look at you, they will say, you are what you eat. It's a very clear fact. You are what you eat. If you eat the wrong thing, you're eating unhealthy stuff and your body is getting disease. So basically, take care of, try to avoid all this soda and all these drinks, which are fizzy drinks. Drink a lot of water. Water is very, very good. Make sure that you eat well, eat the right food, because your body needs proteins, body needs carbohydrates, body needs fat, body needs all the vitamins. And today, everything is available on the net. So you know what is good for what. So make sure you eat the right things at the right time. And can anybody tell me, where is your digestion starting? Anybody can tell me?
Mouth.
Where is
sir.
it?
Mouth.
Huh?
From mouth.
Mouth.
Of course, 100%. So basically, anything you have, see that you take care that before the food enters your esophagus and goes down to your stomach, that you chew it well. You chew it well, make it pulp, and then swallow. Don't just gulp your food or swallow your food. Okay? They say you need to drink your water. Drink your food and eat your water. You need to drink your food and eat your water. When I say this is, you have to make sure that your food, whatever you eat in your mouth, gets around with the saliva, mixes well with the saliva, and then goes into your system. This is not a joke. And before that, say a word of prayer. Thank God for the food He's given you to eat and given you the healthy food to eat. So basically, all these small things, and don't get distracted by using the phone or watching TV or being on some gadget while eating. Concentrate on eating. We tend to we are very busy. Our lives are busy, I know. We tend to just quickly eat, run away. No. You need to devote some time for your eating. I told you, Vishnu sir has mentioned, I have been living a disease-free life, a medicine-free life for the last 25 years. I have not had medicine. No cold, no cough, no fever, no. So basically, you have to, if you take care of your body, the body will be good and you will be living a healthy life. So make sure that you eat well, eat the right food, avoid the junk food. I know, I'm not saying that in life you have to experience everything. I'm not saying that you cheat. You have a cheat day. You should have a cheat day also. You can't go by the books, people. So basically, I'm not saying that but you have to be conscious of your body. You should enjoy your life. I'm not saying don't enjoy your life. Enjoy your life. Do what you need to do, but take care when you make masti today or you go out of your way and do the cheating. Next day, you correct yourself. Avoid everything. See, fasting, try to stop eating. Just keep your body clean. Make sure that it is every day you have to make sure that your body is clean. Absolutely no constipation. Constipation is the mother of all disease. So basically, you need to make sure your system, at your home, you clear your dustbin every day. I'm sure those who are really, hygienic, you don't accumulate it. So basically our body is the same. We need to clear our system every day and make sure that it's flushed out properly. If you're getting constipated, you're having an issue. So make sure you drink a lot of water and keep yourself healthy and fit. Now, next one is your quality of your breathing. Normally, most of us don't breathe to the maximum capacity. When we inhale, we have to take deep breathing. Make sure the oxygen, what is happening in your breathing? I know everybody knows it, but people are very ignorant. When you inhale, you're inhaling oxygen, inhaling and getting into your system, going into your lungs, and basically then the exchange is happening in the lungs to the heart, purifying the blood, and then blood is being circulated. So this is just the broad thing. So basically you must understand how important breathing is, because you're inhaling oxygen. And this oxygen is going ultimately to purify your blood, oxygenate your blood. Not only oxygenating your blood, but oxygenating all your cells in your body. So you must understand how important it is to breathe correctly. Exercise is to keep yourself moving, your joints movement, you keep yourself fit by keeping all your body, rather than being, sitting in one place and not doing any exercises. Keep your body is created for movement. If you don't move, your muscles get stiff, your body gets stiff. And then, see, let me tell you another thing, Alton. If you do your exercise regularly, your muscles become strong, because that is the one which is bonding your bones. Keeping your bones together is your muscles. If you don't keep your muscles strong, your muscles become weak. And believe me, when I say this, if you regularly do exercise and keep your body, your muscles fit, even if you fall down, even if you, by mistake trip and fall down. See, a lot of people break their hip, break their back, I have also fallen. I've fallen in the bathroom, believe me. And I was numb. But believe me, because of doing yoga, I was numb at that moment of time. But I got up. After being on that floor with that pain in my mind, I said, my God, I think my back is gone. My backbone is gone. I thought about that, yes. But for those 10 minutes, 15 minutes of pain and keeping your mind strong, no, I don't have anything. I'm very good. My body is strong. I have overcome all that. And even in spite of doing, next day onwards, start doing yoga. I have not had, yes, I did get pain. I did experience pain. It's not that I'm not a God that I don't get pain. No, I have experienced pain, but the thing you do when you do yoga, your body becomes so strong that all these other things does not bother you, does not affect your body. It's so powerful. Last is your quality of your sleep. We need to keep yourself calm before going to bed, say a word of prayer. Make sure that you keep yourself, do a little meditation. Keep yourself calm. Don't go into the electronic gadgets. Keep the electronic gadgets away from you. And try to get proper sleep, deep sleep. You know that your organs are all functioning, getting the rest and functioning in the night. So basically, don't go to sleep at 2 in the morning, 3 in the morning, whatever. Make sure that you sleep well. And also get your sleep and get up in the morning as well. Get up in the morning early. I think most of you know what is Brahma Muhurta. So getting up in the morning, and again, first of all, thank God for this wonderful day He's given you. Most of us forget about all these things. We just rush into whatever activity. So basically say a word of prayer, read your holy book. Meditate on what has been told to you from the holy book, and then correct yourself and move along. So, and then you will have a bed of roses. Believe me, your whole day, if you go and do your exercise, then after that, your brain is oxygenated, your body is oxygenated, all your cells are oxygenated. You will be alert. You'll have a good IQ. you'll have good memory, you'll have good power of thinking, power of analyzing. Everything will fall into place, provided you do these basic things. And all these is not something which I'm just giving you gyan about. No. You should follow this. If you follow it religiously, no disease will ever affect you. Your life will be powerful, very, very healthy. So next. Okay, now coming to yoga practices. Yoga practices, I love that. Yoga is something which I would want everybody. Don't go to the gym. Gym exercises is temporary. But if you do yoga, you can practice it till you're 90, 100, and you will be fit and healthy. But you have to do it religiously every day. Even if I don't do exercise for one day, I know my body will affect. Next day, I'll feel, oh, I'm not stretched. So it's so important. And next thing is cleansing activities. All these things are cleansing activities, which when your body has got ailments and you go to a rejuvenation center, or you go to the Ayurvedic center, or you go to the wherever, detoxing, what they're doing, they're basically cleaning your system. So you need to clean your system. And these are the various yogic practices, Shatkriyas as they call it. Cleaning your nasal passage, cleaning your sinus, cleaning your esophagus, cleaning your digestive system, cleaning your lungs. So everything is yogic activities, yogic cleansing activities are highly effective. And when you get into the yoga thing, you'll understand what I'm saying. So basically, you should follow this. You can, and everything is available on the net. What are the Shatkriyas and what are the cleaning activities? So you must understand that it is cleansing your entire body, right from your brains and right down to your nostrils, and then right up to your intestines, cleaning everything. And then, of course, you have warming. When you start any exercises, you need to warm up. And that's the Sushma Vyayam. That means you're actively keeping all your bones, all your joints active. And if you keep yourself, other thing is keeping your posture. Do not keep your posture erect. Keep your backbone always erect. Don't sit sloppy. Don't walk sloppy. Do not, go ahead. Sit straight and go ahead and, live your life in proper position. Don't sit on the couch or sit on the chair in a clumsy position. Make sure that you enjoy sitting in the right way, because a lot of people are loving the clumsiness, loving the way you sit down, the way you take your breathing, because it affects everything what you do. Because if you don't breathe properly, you can compress, and you don't sit properly, your body does not get the proper circulation as well. So Sushma Vyayam is the warming up exercise, which we will go through in the next couple of days. And as a procedure, we will do the exercises. And I want you to come prepared from tomorrow onwards. Wear your normal yoga dress, and also participate religiously in the activities. Okay, next. So, okay, now see, these are some of the, everything is on stretching. You have to stretch. Tadasana, if you stretch your blood circulation, your spine, your knee joints, your toes, your ankles, your thigh muscles, your calf muscle, everything is activated in this posture. So it's such a powerful posture. When we do it, I will really, tell you how to do it, and we go about it religiously. And the other exercises, this is Trikonasana. Then you have the Surya Namaskar. Okay. So next one. See, Surya Namaskar is something which is the holistic exercise. It's an all-round exercise which activates all parts of your body. All your bones, your breathing, everything has been all in one. So basically, if you do that religiously, because if you do it with more practice, you tend to, develop your energy, you get your breathing correctly, and your blood circulation happens very well. and you can overcome all the diseases. Next. Now, what I'm saying is all the sitting exercises. No, sir. Go back. Sorry. I didn't do the sitting. Okay. Sitting exercises are also important. Basically, there are some exercises like Ardhamasyasana where we have the activating of your pancreas. We will do this. All this, Mandukasana. All these things we will do when we think, and you know the effectivity. And when I am explaining to you, I will tell you, yes, it is good for diabetes. It is good for, cleansing your detoxing, or even, effectively improving your blood circulation and activating your pancreas, your internal organs, all that stuff. So basically, you have Dandas and Paschima, all these Vakras, a lot of these exercises, which we will practically go about. So let's focus on that when we have the time. But as I said, you need to come prepared and do the exercises with me. Next, sir. Now, these are the sitting exercises. Now we have the lying down exercises. These are also good. Everything for your, for your body, good for your diabetes. All these exercises good for diabetes. So you basically follow it. Do it with me and we'll do it. We'll enjoy the process. So basically here, see, if you see he's squeezing. This is removing the unwanted gas from your system. Pavana Muktasana. Remove the gas from your system and clear your, your gassy stuff inside, accumulation of gas in your body. Okay, next, sir. Okay. Now we have the other exercise. These are now you have the standing exercises, which are your Sushma Vyayam, and then we go on to the asanas, and then we go on to the lying down exercises, which is your supine exercises, and now we come to the prone postures. All these exercises are very effective for diabetes because they are, affecting your digestive system, your pancreas, your kidney, your liver, your gallbladder, your stomach. All these things have been affected. So basically, we do these exercises together. And see, anything you do, any exercise you do, if you're just doing it for the sake of doing it, please don't do it. When you do exercises, you need to do it that, this particular exercise is affecting my neck or my joints or my belly or my hand or my whatever, the calves or my back. So you must understand what the exercise is for and accordingly do the exercise. So keep your mind alert. What is happening? And don't just do it for the sake of doing it. Most important is your breathing. In any exercise, if you breathe correctly, your body will improve. If you don't breathe correctly, your body will not improve. It will be bad for your body. So make sure that any exercise you do, your breathing has to be correct. Your breathing has to be correct. So make sure that you practice, do the correct breathing for every exercise and try to do as much as you can. There is no compulsion. Even for me to do exercises, I was not able to touch my toes. I was not able to sit in Vajrasana when 25, 30 years back I'm talking about. I could not sit. I don't know what is, all these guys are standing and, I'm like a stupid character sitting there and can't bend and do. So I was very obese. Yeah, my story, I'll tell you, I was an asthmatic from childhood till my graduation. I was a severe asthmatic child. Okay. My father and mother really suffered and tried to do all the things to take care of me and tried all the doctors. They tried medicines, which they tried Ayurvedic, homeopathy, allopathy. They tried giving me all the thing, Morarji Kola, you might be knowing. So all that, my dad, he was desperate. He didn't know how to treat me because seeing me suffering, not sleeping nights, always sitting on the bed and breathing deeply. I know my parents went through a hard time. But believe me, yoga, they took me to the Yoga Institute in Santa Cruz, and I started my yoga journey there. And that Dr. Jayadeva is no more there. He's passed away. But I'm saying that because he introduced me to yoga, my lungs have become strong, my body has become strong, and I don't have any asthma. I don't have any other problem. I was obese. I told you my waist size was 40 inches. I was a clumsy guy. I used to love food. I used to eat a lot of food. I enjoyed my life. But so basically, there was some correction. As I said, you listen to your body, you will know that when you have to correct yourself, because if you go on to that, then you'll get blood pressure. You'll get. I was on the borderline, blood pressure, diabetes. I already shared it with you. So basically, all these signals have come to me already, and by God's grace, I've been overcoming this. And I have written my book because I have helped other people get rid of their diseases. And today they're sitting. I've cured a person who is bedridden, and today can ride a cycle and being very active. So basically, nothing is impossible, my dear. You have to keep your mind focused, your mind sharp, and you have to be a strong person at will. Your willpower must be there. You must say, "Oh no, I don't have." The more you attract all the diseases, the more you say, "I've got diabetes, I've got blood pressure," the more the illness will come to you. Tell yourself, "I'm strong, I'm good, I'm peaceful, I'm healthy, I'm active. I don't have any problem." The more you say, "I got this problem, that problem," all the problems will come to you. You're attracting the problems yourself. So mentally, you need to be strong. Most of us give up and they say, "Oh, no, what doctor says is right. What I believe, what I believe, or which I have to have the medicine." I have gone through all this and I have not had any medicine. And I'm gone for all my medical checkups, the treadmill test, this test, that, and whatever test. All the tests are gone positive, very good heart, very good. So basically, I want everybody to understand that nothing is impossible in your life. You can do anything and everything, provided you have a strong willpower and you take care of your food and your dietary habits and your exercise and your breathing and all what I've said. Okay, so next. Okay, then breathing. See, this is all breathing. Pranayama is all about breathing. So you can overcome illnesses if you practice Vastriga, Anulom Vilom, Brahmari, Shitari. We'll go through this when we do our daily exercises till Friday. And last but not the least, we have meditation and prayer. So meditation is something which you need to practice every day. It's very important. Just sit yourself calmly and reflect on your body, reflect on your day-to-day activities, and keep yourself at peace, because, a peaceful mind is everything. The more you are tensed, the moment you're tensed, your blood pressure rises. You don't have to go and test your blood pressure. Most of us, we go and buy the blood pressure machine and test your blood pressure every moment, which is a wrong idea. Never test your blood pressure when you're stressed or when you're tensed or when you're in a deep trouble, or when you're relaxed. That's the time you have to test your blood pressure. Your mind has to be calm. Your body has to be relaxed. Then you test your blood pressure. And then if you have blood pressure, then I can say something is persistently happening and you have it. Otherwise, you don't have to. People go to the doctor, running to the doctor, or being stuck in a traffic jam, or run, and then doctor says, "Oh, your blood pressure." Believe me, doctors are interested in giving you medicine. Doctors are not interested in curing you. They will want to give you the pill because they love to sell what they are selling and make you, "Oh, you have got this." Then you need to go for a block check, the angiogram, or all these, your heart checkup. You don't have anything here. You're perfectly healthy, provided you think keep yourself mentally strong and keep yourself calm. And that's how it is. So life is a roller coaster, no doubt. But if you respond to it and keep your body healthy and calm, no illness will come to you. Absolutely no illness. You will be as strong as ever. And you will tell others, I'm a testimony to all this. I tell people, but people don't want to listen. People don't want to understand, because they think, that you take a pill for every ill is good for them. It's absolutely wrong. And they are happy about it, because for one pill, if you're having diabetes, as you saw all the problems which happen because of diabetes, you have continue having your diabetes medicine, you get your blood pressure, you get your problem with the kidney, you get the problem with the liver. Why? The doctor, he will say, oh, you need to have, whatever, metformin or whatever. Have your diabetes medicine. Then after he'll say, oh, I think your liver is, your problem is there. So he'll give you another one more medicine. And you like it. Oh, yeah. Believe me, I'm not telling you this. I've got cousins people in my family itself, they think, oh, you have not done, what is yoga? Yoga is not approved by the FDA, a Food and Drug Administration. You see, basically, people are not interested in listening to you. You have to listen to yourself and your body, and you will be okay. So, as I said, I have lived my life perfectly well, and I want others to understand and live their life to their best capacity, provided you listen to your body and be calm and stressless, stress-free life. Okay, now we'll say, I think I wanted you to do the meditation every day. We'll say a word of prayer. I think we'll end this session. So I want okay, now, sorry, yeah. So now, I told you I'm a naturopathy expert. See, this is what you need for naturopathy. You need to do fasting. Fasting is very important. Right now, like for us Christians and then Ramadan, people have fasting. How important it is, you see. Your body needs to be, take some rest as well. Your digestive system needs to take rest. So fasting is important. And enema, everybody knows what's enema. Enema is your basti, your cleaning your system. That means they have this tube which they put into your anus, or you have the water getting into your thing. They either put lime water, warm water, whatever you have, and then you feel when you go for detoxing. If you go for detoxing, people do it. This you can do it at home. You don't need to go for the Ayurvedic center or something. You can do this at home. If you have the time and if you have the will and if you have the mental stability, you can clean your system yourself. You don't need to go to a rejuvenation center. You don't need to go to Ayurvedic hospital. You don't need to. You can do all this yourself. Then consume boiled or raw vegetables. As I told you, when I say raw vegetables and fruits, these are very, very nutritional. And have it raw. Don't make fruit juices. If you can have the fruit yourself, have the fruit in the wholesome as a fruit itself. Don't go and crush it and make it juice and then have it. No. Because it spoils the thing. Because, you should have it immediately. Or better to have the fruit itself. So you get the fiber and everything in one go. Then, your fridge. I know people love to stock the stuff in the fridge. Love the microwave. All these things are things which are not needed. The more you use it, the more illness will come to you. So try to avoid it. Try to have fresh food. Cook little, have it, consume it. I know it's a lot of pain. People say, oh, I've got to cook a lot of. So you cook for a few days, and then heat it and you have it. This is what people are doing. Okay. Then bathing in cold or warm water. So this is one. Now, if you go to the European countries, like if you go to the, in Iceland or Finland and stuff like that, every house has got a sauna. Every house has got a cold water pool and a warm water pool. So basically, people take a dive in that, keep going to the coldest water. And, keep yourself fit because, everything, your blood circulation, everything happens with this, here you can, for us here to experience it, you have a very cold water, you have warm water bath, cold water bath, that's all. And then light exercises every day. This is naturopathy means you're not having any medicines. You're doing everything which is good for your body, light exercise and walking, and maximum 6 to 7 hours sleep. Okay, now next one. Okay, now, first of all, let me thank everybody for attending this thing. Let's end with a prayer. So close your eyes and recite the prayer. If you know the prayer with me, say it with me. If you want to read it, you can read it, no problem. Om Sarve Bhavantu Sukhinaha Sarve Santu Niramaya. Ma sarve bhadrani pashyantu. Ma kashit dukkha bhag bhave. Om Shanti Shanti Shanti. Now the meaning of that is, may all become happy, may none fall ill, may all see auspiciousness everywhere, may none ever feel sorrow. Om Shanti Shanti Shanti. So if you have questions, please ask. We got 2-3 minutes. So anybody has got anything to ask me, I am all the more happy to answer you. I guess you're all doctors, so you don't. and today Google is your doctor also. So everybody can Google, and the doctor is there already. So thank you for coming. Thank you for listening, and keep yourself fit and
No,
healthy.
sir, there is a form, feedback form, sir.
Yes. Sorry, I want you to spend one minute for the feedback form.
वेरी गुड सर, जॉर्ज सर बहुत अच्छे से आपका क्लास सुन गए हम भी.
Thank you, madam.
वेरी गुड.
I was missing your class from almost 2 years.
Anil is from Spain. You're in Spain or Portugal, right?
Portugal.
Thank you, Anil, for joining.
George sir, it was amazing. Very informative.
Thank you, madam. Thank you. Thank you, Jigna ji. Thank you, Yugandhar. Thank you, Smita ji, for all your help. You've been so kind. All of you have been so supportive. I'm being grateful to this community. I have got a very good yoga teacher community who's been very helpful. Thank you, thank you, thank you, thank you. So nobody has got questions. So I think we'll, Vishnu sir, we'll end the session here. So tell me what to do. Should I?
Let another minute for all of them to fill up the form, those who have not done.
Yeah. Please fill up the form. Please. This is very important for me. Your feedback is very important. Thank you, Vishnu sir, for your help. Vishnu sir is my mentor. He's helped me in this yoga journey. Thank you, sir.
We are very good friends. We are part of Toastmasters team, so that's how Josh sir and I know. But now he has
Thank you, sir.
shifted to.
Thank you for your valuable time you spent with me.
Thank you.
Because I know it's a very precious. You're working, and it's very, very important that you devoted some time for me. 1 hour of your time. I'm thankful to you, grateful to you for everything, sir. Thank you.
Thank you, sir, for your wonderful session. It's always a pleasure listening you, whether it's in yoga, Toastmaster, or anything. Thank you, sir.
Everybody, I hope has filled in the form, please. Okay. Yeah, I've got some questions. Doctor, how can we control IBS? Thank you, Dr. Somasundaram. I think my colleague has very, Dr. Vandana has very vividly explained to you on IBS, no? But yeah, as I told you, it's all on digestion. So you start your digestion here. You don't start your digestion after. So everything you do it correctly and take care of your dietary habits. And then make sure you flush your system every day. The best secret is to have a liter of water in the morning, and don't just gulp the water. Move the water in your mouth. Let the saliva mix it and get into your system. Mix in the morning when you get up. Without washing, without brushing your teeth, drink the water and let the water with the saliva and with the bacteria get into your body. That's what you should do. And that's how, after then you have a liter of water, you will automatically feel the urge of going to the washroom. So very good. I hope, sir, everybody's filled up.
Yeah, I think we should be okay.
Okay.
We can end it. Thank you.
Thank you, everybody. And now we can end the session. Thank you, everybody. But I will see you tomorrow in full swing for the yoga classes. Yes, which is what I'm looking forward to. The theory is is good. Thank you, sir. So
Thank you. We'll end the session now.
So you have to end the meeting.